as an introduction, not only to the team, but the rest of the room, I'm the head of digital technology for NHS England, covering the East of England region. Now, I took up post about 3 years ago in NHS England. However, before that, I was the head of technology transformation at CCG. So one of the largest, or fourth largest CCGs across the country, which was at the time Birmingham Cross City. I think now the second largest, because they've actually merged with Solihull, so Birmingham Solihull CCG. So, and I was instrumental in rolling out the Your Care Connected programme, which is their local record sharing programme, which included 17 organisations, about 118 GP practices, a population of 1.6 million. The only reason I'm telling you that is I know how difficult it is to do digital transformation. And I understand some of the challenges that you face. So, why are we, and this morning I'm actually coming to talk to you about why is it, or what is the national vision for digital technology transformation, and why do we need to do it? So, you've all heard the arguments about the fact that we've got a growing population. We've got a population that is aging, is living longer with multiple conditions, and therefore that demand is increasing in primary care. But there's something else as well. The expectations of patients is also changing. So, if we think about today's lifestyle, it's all about convenience. I can stand here today and order something online and have it delivered to my door by 9 o'clock this evening. And that, to me, is impressive. To my children, that's a norm. That's what they expect. That's how they live their lives. I mean, if we look at the changing demographics over the next 10 years, my children, my eldest is 18. He's that Generation Z. And I can tell you, he uses his mobile phone to do everything apart from make a telephone conversation. Ask him to do that and he looks at you as if to say, what? You want me to talk to people on this? So they're now starting to use primary care services on their own because they're now 18. They're now starting to use those services. Now, the next lot, millenniums, this is where I start feeling really old because I can remember my nieces and nephews being born. They're in that age group now where they're actually setting up their own families. They're now having children. They are also starting to use primary care services. They're also very tech savvy. They believe in convenience. They want services delivered to them in their needs. And then you've got my generation, Generation X. So, like I say, yes, I'm computer savvy. However, I still believe in actually, I can book online, but I don't expect it. And Generation X is potentially over the next 10 to 15 years, your biggest growing patients. They are computer savvy. They do want to use online services. They do want to actually manage their own health. So let's not just forget and just not focus on the here and now. Let's think about where we need to be in 10 or 15 years' time. So when we think about what's the vision from a national perspective, it is about self-care. Because if we're going to manage that demand, people need to be empowered to understand their illnesses. They need to be empowered to actually understand what triggers an acute episode and how can they manage that. And we know patients are asking for this information, and as a matter of fact, it was just shown earlier that patients do feel they are ready for this. We want to reduce the admin workload. We have got a reduction in not just GPs, but also all clinicians, physiotherapists. We're seeing a reduced workforce in primary care. At the same time, we're seeing an increase in demand. So we need to do something to start looking at how do we support our clinicians, and I'm talking about the wider clinical team, to actually spare up some time for them to actually do the work that they wanted to do, which is why they followed the practice they did, which is to look after patients. So what we mean by that is mobile working. The amount of times I've heard practice staff tell me that they have to come all the way back to a practice when they've been out to see a patient either in a care home or in their own home, just to come back to the practice now to download all the information that they've collected on the patient. We need to make it easier for our clinicians to actually access records from any organisation that they're at and to upload that information there and then. We're talking about operating at scale. And what does that mean? Enhanced extended access is a good example of this. It's about practices coming together, working together to deliver services in a different way. So enhanced services is about actually now allowing patients to have services that are outside your normal practice working hours. Not out of hours, but just outside your normal practice working hours. It's also about collaborating to improve outcomes. So if a neighbouring partner, a neighbouring practice has a physiotherapy service but you don't, by partnering and coming together, you're actually offering more services to your patients. And it's also about providing greater efficiencies. So if you're coming together as PCNs, as partners, could you actually pull some of your budgets together and actually think about employing a local pharmacist? Could you think about employing paramedics, which are some practices are now doing? NHS England has been looking at trends in primary care and how patients use primary care. Now, this is by no means an exhaustive list of what patients use primary care for. We know that. What this is doing is picking out some of the key examples of what patients are telling us what they want from their practices. And most likely is to check their symptoms, to understand what's going on with them. We know that 1 in every 20 Google searches is health related. They want to have a medical intervention. They need a medical intervention, but they need it from the most appropriate person within the primary care clinical service. They need to book an appointment. They need to order repeat prescriptions, or they just need to have the latest results from the latest tests that they did in practice, or they just want to understand what's being held in their record. At the moment, the way our services are configured, they all go to the GP for this. And what we're trying to do with things like the online consultations with NHS app is to almost reconfigure some of that so that patients are redirected before they go to the GP to actually think about where do you need to go to get your repeat prescription, to get that sick note. Do you actually need to see a GP, or could an admin staff do that? Do you need to see a GP for your flu jab, or could a nurse do that? So it's those kind of things. I'm glad to see that we had very similar stats on this. So across the country, so we've looked at, our changing generation and what's expected to come over the next 10 to 15 years. This is what's already happening. So across the country, 24% patients are now registered for online services. I know it doesn't seem like a lot of 24%, but we're moving in that direction. We already said 90% of the population in England has access to the internet. 75% of over 15-year-olds have a smartphone. And we have at least 60% of over 65s who are using the internet. So this conception that, 1, the older generation doesn't use it, or 2, that BME population doesn't use it is incorrect. Because I can tell you, for my parents, that they use, my mother only recently got a mobile phone, but my father's had a mobile phone for at least the past 15 years, and he uses the internet. And most BME families will use the internet to talk to people back in their own country. So to assume that BME population do not use the internet is incorrect. So NHSX, so they have 5 missions. Now NHSX is hosted by NHS England and brings together NHS Digital, NHS England and the Department of Health. So it's bringing together all of the 3 major health organisations that are focused on digital delivery. And the reason for doing so is to actually start thinking about you need to bring these services together so that we are not expecting organisations out there to be delivering contradicting priorities. So that's the reason for NHSX. So they have 5 missions. The first one is to reduce burden on staff. And we already had a conversation, and what that means is when we're introducing technology into primary care or into any other services, we need to involve the end user from day one. The end user, whether it be clinician, whether it be your practice nurse, whether it be the receptionist staff or the practice manager, they know how they want to use the system. They know what they need the system to do. So involving them from day one will ensure not only that the system works to deliver the service you want it to do, but as a matter of fact, the uptake is greater. Because quite often what we tend to do is we plug in services and expect people to deliver this. I know, and I've heard the horror stories, and I'm sure you have as well, the amount of clinicians that say they have to log on to 5 different systems just to access a record on one patient. And they have to remember God knows how many different passwords. Now, NHS England is looking into this, and we are looking into actually having one authenticated version of logging in. It's not there yet, but we are looking into it. And giving citizens tools that will not only allow them to manage their health, but it's also about asking them to take the responsibility of also managing the NHS resources. We know how expensive DNAs are. We also know that most patients, if they book an appointment that is convenient for them, are less likely to DNA. Now, I can imagine you're all going, but we haven't got all those appointments. However, if you give the onus over to the patient then checks whether the appointment is available for them on that day for their convenient time, and if not, do they need to make an appointment that day, or are they happy to make an appointment another day? But the onus then is on the patient. It's no different to booking a hairdresser's appointment or booking a table for dinner. The other thing is about sharing information. Now, we've got to do it in an open, secure and transparent way. And what that means is that patients need to know what you're sharing, who you're sharing it with, and for what purpose, and that is all. And it's really important to share information. There have been some major stories that have led to either harm to patients or harm to the public due to a lack of information sharing. Now, the case I can remember myself was the Christina Atkinson case in Birmingham, where a 16-year-old girl was stabbed to death in a rush hour bus on her way to school by a patient who had mental health needs and who was known to services. He was known to health services, he was known to mental health services, he was known to the police service, and he was known to the prison service. However, due to lack of information sharing, he was on that bus in a psychotic state on that fatal day for Christina Atkinson. there are lots of reasons why it's important to share information. That was just one very particular case. However, we know medical errors happen. We know patients have allergic reactions. So it's really important that we're sharing that information. And it's to increase productivity. And what we mean by that is, of course, we know we've all talked about workloads. And we've all talked about, as a matter of fact, how do we ease that workload for patients. So I'm not going to go on about that because we've already discussed that already. So to support some of the digital transformation in not just primary care, but in all organisations, there are a number of national programmes that are currently either underway or due to be. So we've already had a discussion about the NHS app, and so I won't go into detail about that. We have the NHS website. Like I said, 1 in 20 searches on Google is related to health. So the NHS website is the website that we think, and we know that by searching on medical conditions on the internet can actually be the worst thing you could do. The NHS website is trusted information which will give patients the right information to manage their own health. We've got personal care records and the interoperability of those. We've got the NHS app library. Now that is for assessing apps which are coming on to becoming recommended health apps, which go beyond what the NHS app does. And we've got, of course, the rollout of Wi-Fi, which has been completely rolled out in the primary care estate and is currently being rolled out into secondary care. And it's about how do we use those tools to get the best services we can for digital. Online consultations been talked about. This was introduced, I think, at the back end of 2017. And for me personally, I always think it's probably been worded incorrectly. It's called online consultation. What it actually is online triage. And what it does, and the reason it was introduced, was to ensure that we know there was a study done in 2016 by NHS Alliance, which looked at releasing time in GP practices. And it demonstrated that 30% of GP appointments could be managed better by other professions. And what online consultation does is allow patients to enter their symptoms on a form which is then triaged by that service and directs them to other services. Like I say, we've already had a discussion, so I won't go on about that. The other one is, which has got and the only thing I do want to mention about online consultations is it does have a target of 75% of your population having access to online consultations by March 2020. The other one that's got a target by March 2020 is direct booking, NHS 111 direct booking into GP practices. Now, I know that in East of England that we're not there yet, and we're not there yet not due to any issues with GP practices not being ready to do it. As a matter of fact, we know the NHS 111 system suppliers do not have the capability at the moment to allow direct booking. IC24 have just been through a pilot stage and will be up and running with direct booking by the end, I think, of next week. The target, however, is by March 2020. So to get you from that to actually allowing direct booking by March 2020 is a huge ask, and there is a lot of things you have to do as a practice to onboard yourself, and that one of those is actually having data sharing agreements. So if you have got a system which allows you to do that simply, you're already there. However, there is also about allowing funding to flow to local systems to allow them to actually do some of, I suppose, digital innovations that are needed to meet their own local challenges, whether it be accessibility, whether it be delivery or distribution of drugs. So these are just outlined. So accessibility, we've already talked about, working with your practices, neighbouring practices, and having an online scheduling system potentially that would allow you to actually share resources. You've already talked about online consultations that would actually improve access. Drugs, EPS, ERD, which is electronic repeat prescription dispensing, which are all systems that are now available in the NHS, and we're happy for local systems to start trialling these now. Funding and guidance around these are available. To talk about funding, most recently we are about to release for East of England £3 million and this is revenue funding to actually support implementation support for, and it's broken down in 3 sections. One is to help you deliver some of the national programs like online consultations, like NHS Direct Booking, and what it is resource funding, so you can actually bring in people to help you either do the engagement with your GP staff, or you can actually bring in staff to help you change the processes in that practice front end, because we know from when we've had discussions with practices that that's the support they really do want. It's one thing plugging a system in, it's another thing to actually then change your processes so it's working efficiently in the practice. So the £3 million funding is broken into 3 sections. One is to help you do an element of implementation of national programs. The second one is there are a number of targets in the GMS contract, which are for the responsibility of practices to deliver. Some of these being having an online presence, having a patient-facing website or a patient-facing email address. So a certain amount of that funding has been released or will be released to PCNs to help them develop their digital offer. And the last element of that funding will be to identify some accelerator sites, primary care accelerator sites. And what we mean by that is we know for digital services to actually work, it's not simply taking your actual physical services and putting them online. It's about changing the way we interact with those services. So Amazon, for example, started off by offering books online. Completely different to what they do now. And it's about changing your processes. So it's not simply just taking your physical, what you're delivering today, and putting it online. It's about making sure you have the interventions, digital interventions that actually are changing pathways of how patients access primary care. So we've got, I believe, 1.5 million to identify accelerator, I think it's up to 3 accelerator sites in the east of England who can identify changes in pathways that then can be scaled up and shared across the country. So I'm not going to go on these, and the slides will be shared afterwards. So I'm not going to go in detail about this, but what I've done is just put out some of the requirements that are in the long-term plan that have a touch point for primary care. So you've got there digital first primary care becoming the new option for every patient by 2023 and 2024. That's over the next 5 years. That digital first primary care will be an option for every patient across the country. You've got the NHS app, which is about 30%. And then you've got, by 2020, support for long-term conditions. In the GMS contract, you've got the online consultations. So in the GMS contract, like I said, at the moment, you've got for online consultations a target for 75%, and that's in the CCG operating framework. In the GMS contract, in Annex D, which is a non-contractual element, there is a requirement for all practices to be offering online consultations to their patients. At the moment, it's in the non-contractual element. However, what's in the contractual element is that by 2023, you need to be offering video consultation to patients. Now, the reason why online consultation came before video consultation was that we understood that you needed to, online consultation, like I say, is a triage system, that if we introduced video consultation without introducing a triage system, it was not going to reduce any demand, because you still, to do a video consultation, you still need a clinician at the end on the video. So by doing online consultations first and online triage, what you're doing is taking at least 30% of your demand potentially out, and then providing online video consultation with a clinician to those patients that actually need that. So, like I say, I know we're running very short of time. The slides are available, and I will be around to answer any particular questions. The only thing I wanted to quickly share was the journey so far. So what's currently available is we've got online appointments available, repeat prescriptions online available, GP access to summary record available. We're currently in the process of rolling out online consultations. NHS app is rolled out, however, utilisation is still very low. And then what's on its way is the enhanced practice websites, online access to the full GP record. And of course, LICRA. LICRA is local healthcare record. So it's about sharing local healthcare records, not just within an STP boundary, but actually beyond that. And it is the vision that we will have a LICRA that will cover the whole of the country eventually over the next 10 to 15 years.
Thank you, Jasvinder.